probably the most important is insulin resistance. Other things associated with this are oligomenorrhea, which means infrequent menstrual periods. And this is really kind of the hallmark or one of the biggest clues that we have when patients come into us that they have this issue. They may skip 2, 3, 4 months in between cycles. I've had some patients even 2 cycles a year at the most. That's a problem, and again, especially as we talk about one of the biggest reasons that patients come in is infertility. Dyslipidemia is another problem. Dyslipidemia is a fancy word for elevated cholesterol or elevated triglycerides. Again, this is oftentimes associated with the insulin resistance, and also carries an increased risk then for cardiovascular disease. Another thing that you'll see in some patients is something called acanthosis nigricans. You'll get kind of a thickening and a darkening of the skin, usually in areas where there are skin folds, the back of the neck, under the armpits, any creases, even in the waistline, you can sometimes see this. Skin tags are also common, and the one that I know is more scary for people is cancer. The problem with PCOS is that it's a high estrogen syndrome. You have high estrogen that's stimulating growth of the lining of the uterus, and you're not discarding that endometrium monthly as you should. There is a potential that you can actually stimulate those cells that line the uterus to become cancerous. And so this is really an important thing to take care of. So if you miss periods, again, you need to go see your provider so that you can have this appropriately diagnosed.